Hi, everyone. This is Dr. Ann Jones, Medical Director from Cornell Health, and I'm here to answer some common health questions that are coming up about coronavirus and the COVID response here at Cornell Health. The new guidance from the Centers for Disease Control and Prevention about the recommendation for masks. If you do have to go out of your house, and be in an environment where you're out in public, it is recommended to be wearing a mask or a cloth face covering. And there are a few key specifications for this. Again, the reason why we recommend cloth face coverings and masks is to protect others from what you may have either as symptoms or before we get symptoms in the case of potential asymptomatic spread. So there are a few key tips about face coverings. I actually happen to have a mask here in the office and can show you a little bit with one of these masks. The key piece is to ensure that both your nose and your mouth are covered. And the key way to do that is to make sure, if you're using a mask, like here's one mask, to make sure to pinch the area that covers the nose and then bring the lower part until it covers all the way down onto your chin and across your mouth. So the way that you would do this is to put this on your nose, make sure that it covers your nose, pull this around, make sure it covers your mouth, and then that would be the area that you would need to cover. Now, if your mask has these loops, then you put them over your head. Some masks have ear loops that you can put over your ears, and some masks have little ties. Whichever ones that you're using, the key part is, remember, pinch the nose, cover the nose, bring it over your mouth, and then cover it tightly in the back. If you're using a cloth face covering, the CDC actually has great resources. They have charts that you can use to sew or create your own mask, or tips and tricks to use a cloth item or fabric that you have at your home. The key tips, if you are fashioning or making your own mask, sort of in a similar way to using a surgical mask, make sure that it fits snugly over your nose and over your mouth and across your face. Make sure that it can be secured with either a loop, an elastic band that goes around your ear, around your head, or it can be tied in the back. Make sure it includes multiple layers of fabric, that it's not kind of one thin fabric, but that there are several folds to ensure that there is that coverage and protection. And at the same time, though, that there is a space that's allowed for breathing on both sides. Also one that would be able to be laundered or washed if it got soiled in any way. So those are some key tips from CDC. Now, there are certain individuals who may have respiratory difficulties with wearing masks. So if you do have a chronic health condition or respiratory difficulty in any way, certainly reach out to your healthcare provider who could advise you specifically on what would be best for you and your condition. And I wish you much health, much safety, and all the best as we continue to come together to get through this unprecedented time. Thank you.